Alright, so this Kahoot, before we get started, this Kahoot has 19 questions, I think. These are kind of like introductory level questions to all of the exemplars, other than, well, actually, they're shop questions. So there's hypothermia questions, hypothermia questions, burn questions. So it's kind of like a pre-test to kind of see where we are before we get into all the exemplars. Okay? So pre-test. I don't expect everyone to do well on all of these. Start over. Yeah. Restart.
Yes.
Y'all got really excited?
That adrenaline starters.
Alright, so when we get into our burns, we have, I put both terms up here for you. So first, second, third degree, also called superficial, partial thickness, and full thickness burns. So I put the terms up there for you. First degree burns, do those hurt?
Yes.
Yes, they're horrible. Second degree burns, do they hurt?
Yes.
Most painful, extremely painful are the second degree burns. So that's our most pain. Third degree burns do not hurt. Why? We've burned all the nerves off, so there's nothing to hurt. So we'll get into these different types of burns. But again, pre-test. I'm gonna say y'all knew that, but you just hit the wrong button. A little bit harder. You gotta read. Can you pause it? Sorry, those get all the back.
I feel
The
the
font's
zero
a little.
I hit it right as the time went up.
I didn't get any points. Oh my God, Jeff stayed. Okay, 21-year-old in a house fire with peak T waves and burns to the back. What is this telling me? We have hyperkalemia because we're having peak T waves. So our burns patients are high risk to develop hyperkalemia. Why? Because of all of the cell destruction, they release the potassium. So that person is telling me a lot of cell death, hyperkalemia, they can go into sudden cardiac arrest anytime. 7-year-old with a chemical burn on the hand with a hysterical family. Sorry, just gotta deal with them people. 50-year-old with superficial burns to 90% of the body. They just got a bad sunburn. They'll be alright. Deal with you later. 50-year-old with an electrical burn on the toe or the ankle. If anything, I would say that one would be my second choice, just because I don't know how bad the underlying damage is until I do further assessment. But that 21-year-old, the further assessment with those peak T waves, I got double whammy. I got a burn and hyperkalemia. So I'm gonna treat that person first. Very good job. Narcan is the antidote for what? Opioids. Acetylcysteine is the antidote for Tylenol. Also given to protect the kidneys against what? Contrast dye. Protamine is the antidote for heparin. Flumazenil is the antidote for benzodiazepines. So we will have all these on our content this test.
Yes.
You tried to win. It's too fast. Okay, I don't care what any of that says. What does that say?
No pulse.
No pulse. Done, period, end. Doesn't matter what else the situation says. No pulse equals CPR. You do all the other things while someone is doing CPR. So if you learn nothing, no pulse equals CPR, CPR, CPR. And then yes, please go get the Narcan very quickly. But CPR is never held for anything. That is the most important job in a code. Most important job. CPR, CPR. They're like slowly trickling in. Alright, if someone had a near drowning event, the priority is going to be oxygen, airway, breathing. We're going to do all these other things, which we'll talk about when we get into the near drowning content. But near drowning, airway, breathing, oxygen, oxygen, oxygen. Alright, very good job. So hydrocephalus, that is going to be hydro, water, cephalus, head. So we have too much usually CSF buildup in the head, so this is typically congenital, but it's not always. If you read like causes of hydrocephaly in your book, it's like long list. A lot of them are congenital, but we do have non-congenital reasons to have it as well. Thank you. Do adults have fontanelles? No, they do not. So, bulging fontanelles we see in infants until all fontanelles are closed, and then we no longer have that symptom to help let us know that the patient is dealing with hydrocephaly. All the other things can occur in infants and adults. Those are all signs of hydrocephaly. Kind of evenly divided. All right, hypovolemic shock. We have low volume, which means we would have a low blood pressure because we have low volume. If you have a low blood pressure, what's your pulse going to do? It's going to go up and get really high, and your pulses are going to get weak and thready because you can't feel them as much. And then we talked about, do we breathe fast or slow? When we're in distress, we breathe fast. When we hyperventilate, we're trying to get more oxygen in. snake bite with nausea, vomiting, and joint pain, spider bite with nausea, vomiting, and joint pain, that's not good. Snake bite with a metallic taste and numbness in the extremity, that's not good either. Dog bite, as long as they're not bleeding out from if the dog got an artery. But angioedema is gonna win. Oh, knocked off. Yep, he's hot, cool him down. So temperature of 105, cooling measures should be implemented. And we'll talk more about those symptoms when we get into hyperthermia, but if someone, it's real basic. If someone's too hot, cool them down. If someone's too cold, warm them up. You don't even have to read the rest of that one on educate. All right, for a hyperthermia patient, if your temperature is 105, what is your body doing to try and cool you down? Sweating. So you are going to lose volume very quickly with hyperthermia because you're going to sweat all of your fluids out. So hyperthermia is a type of a hypovolemic type situation where we've lost volume. So we need to replace our volume. I always wonder if anybody's gonna take me up on the turkey sandwiches, just to be a bit. Most important to assess further with the snake bites. Snake bites can hurt, so the pain 10 out of 10 is kind of expected. They're also gonna swell, so swelling is kind of expected. But when we start having numbness, tingling, that's showing me that there's some nerve damage going on. So this one needs to be evaluated a little bit more. Alright, very good. Alcohol poisoning. What do people that have drank too much alcohol do? They vomit. So risk of aspiration. Even with someone who doesn't vomit, like someone who's passed out, they aspirate their own saliva, end up with a lot of problems. Yeah. Sometimes aspiration. Alright, pretty good job. So rabies is transmitted from a bite from a wild animal or a non-vaccinated animal. So like a domestic cat is supposed to be getting vaccines. So a feral cat would be more likely for that one. but it is through the saliva of a bite from a animal that has rabies. So any person that comes in with an animal bite, like they've been out hiking, camping, something like that, we're gonna worry about rabies. Kind of everywhere. All right, so the reason we always, anytime a hiker or a camper or somebody comes in when they've been bit by a wild animal, we treat for rabies when they come in, no matter what. Because does anybody know the survival rate of someone who actually develops rabies, like symptoms start? Zero.
Yeah, sorry.
Okay. There is one documented case of one person worldwide that's ever survived after symptoms start with rabies. So just the one, and she is not neurotypical. She's severely handicapped, has to be lifted to a wheelchair, minimally communicated, pegged to. So that's her life, but she did survive rabies. But just the one case that I know of as of right now. So anyone that has had a bite from a wild animal, we are going to treat for rabies, just so that it doesn't actually set in.
What's the most common animal, like a raccoon or something like that?
I can't remember. I knew this.
I feel like people are terrified of rats. Because they're terrified.
That'll be whoever gets that assignment has to find out. Alright, what is the name of this rhythm? That is ventricular tachycardia, VTAC. And that is part of our content we're going to be doing. That rhythm needs to be defibrillated because it is a medical emergency. So I put shock up there just because we really haven't gotten into defibrillation yet. So I just went with shock. But yeah, shocking. Okay, is this, no, two more questions. Very good. Do you know how many times I have a headache? All the time. Headache is an unreliable symptom of increased intracranial pressure. It does occur, but headaches also occur for literally almost anything else. So, unreliable symptom. All right, last one. Is it rectal? Yes. All right. The other good option would have been rectal. All right. So if we have a patient with hypo or hyperthermia, our best way is to measure a core temperature. So I gave you axillary, temporal. Those are absolutely no's because those are surface level temperatures. Oral would be better than those two, but a bladder temperature, a rectal temperature, we can even do esophageal temperatures if the patient's on a ventilator. Those are going to be our core temperatures, and that's what we monitor for these severe highs and lows. Good one. All right, are we ready to present? Okay, we have Austin presenting for overdoses first. Overdoses. Take it away.
Awesome. So we have overdoses. We have a fun guy named Gary. Gary's a 38-year-old male who's found unresponsive on his couch by his roommate with several empty med bottles and half-empty bottle pocket nearby. EMS reports pinpoint pupil shallow respirations at only 8 a minute. Glasgow Coma scale of 6. An empty bottle of Prazolam, which is Xanax. And it's empty, 60 tabs, filled 3 days ago. That's a lot. That's down. That's very good. It's down.
Yeah, good time.
Partially full bottle of hydrocodone, acetaminophen, Norco were found on a coffee table. A half empty bottle of vodka, a liter bottle, was next to him. And his vitals were a blood pressure of 88.4, heart rate of 52, respiratory rate of 8, and O2 of 82 on room air with a tip of 96.8. So the only thing that's good on there is 10, kind of. All of those are just downers. So he's probably feeling down before this, but he's feeling real down now. So we're going to talk about a little bit of the antidotes before any of the things he took. Well, he did take some acetaminophen, but that's at least some worries there. Antidote for that is acetylcysteine. For opioids, the antidote is naloxone, better known, Narcan. Benzos, flumazenil, I believe is how you say it. And I don't know why we threw on insulin for glucagon. I guess with alcohol, I think that can cause. So I don't know.
I don't know, I've had somebody overdose on insulin.
For sure.
I didn't know what they were shooting up, they just shot up something.
Anything for a good time.
His good time was permanent, because he shot up a whole bunch of insulin.
Oh, no.
Dang.
Now, if you have no idea what this person took, if you find them unconscious and unresponsive, Narcan, naloxone, you can use that. Activated charcoal, best used within 30 minutes. Apparently, it's 30 minutes within ingestion. If somebody took it more than an hour ago, apparently there's very little clinical help for you by taking it, but you can still take it, I think. I don't know the contraindications off the top of my head, don't quote me. Stomach pump, up to 2 hours after ingestion thing. Now, for our interventions, number 1, assess. If you're given something naloxone, it has a very quick half-life. So they can reverse, go right back into that overdose without you paying attention to it. So assess. You're going to assess the air pulse, vitals, of course, lungs, airway patency. This is talking about like paramedics, but we don't initiate airways, but of course, CPAP, BiPAP, if they've already threw up, you're going to throw that right down into their lungs. Color of their skin, if they're pale, cyanide, things like that. Mechanical ventilation, if the respiratory rate dropped to 10. Continuous pulse ox, of course. Suction equipment at bedside, especially for the aspiration risk. IV fluids for resuscitation. 2 large bore IVs. Throw some more if you want. Monitor vitals continuously and pressors to keep their MAP above 60. But yeah, essentially, treat it with the antidote if you can. If not, I guess symptomatically.
He brought up a fantastic point. Please don't ever put a BiPAP or a CPAP on somebody that's vomiting, unless we just want aspiration pneumonia on top of that. So don't do that. If anyone ever vomits and they've got the mask on, please jerk it off very quickly so that we don't shove all that in their airways. I wanted to add a little bit about Narcan. He brought up, the half-life's really short. So we kind of talked about that a little bit. So short half-life on Narcan. The other issue is, I don't know if Gary is a habitual drug abuser. We apparently have good access, so we might be. So if someone's not a habitual user and we give Narcan, there's not a whole lot of issues I'm really concerned about. But if someone is like a habitual opioid abuser and we give them Narcan, we're going to throw them straight into withdrawals. So they can go into like lethal tachycardias when we do that. So we have to be kind of just aware of that. The other issue is with Narcan. Anybody given Narcan and they came up like the Exorcist and started vomiting? It's not pretty. When you give Narcan and they wake up, literally like hits the back wall of vomiting. It's intense. So don't stand at the end of the bed. If somebody's getting Narcan, move. So because it's pretty good. So beware when you're giving Narcan. We have the potential of sending them into withdrawals and lethal tachycardias. So a paramedic told me one time, don't completely kill their high, just get it a little bit. Out in the field, they do the sniffers, and the ER, we can give the big dose IV wise. So, be aware. Activated charcoal, put down an NG tube. Protect your clothes, it's charcoal. It will stain anything it touches. So if you don't want your shoes stained with charcoal, just be careful. We just put down an NG tube and push with the big syringe, and then we can lavage and suck it right on back out. If your patient's awake and they can drink it, their teeth are gonna be stained. I mean, they're just gonna look terrible. But just be aware of your clothes, and your hands is gonna stain for a while, so wear your gloves, protect your stuff with charcoal. Only for PO ingestions, please don't give activated charcoal for somebody that's shot up. Just for if they swallow stuff. Works great for alcohol overdoses, unknown pills, somebody takes a whole bunch of psych meds. Works great for all those types of things, any kind of pill.
The acetylcysteine for the Tylenol, is it a drip?
Drink. You can give an IV drip too. So you can give it an IV drip. We don't give that very often. It's most of the time oral. So if they're not awake, we can put down an NG tube and put it down their NG tube. So because we want it to try and hit it whichever route they took it. All right, them's the overdoses. Who wants to go next? Not my burn people, because burns is gonna be too much for today. So burns, smoke inhalation, so electrical burns, thermal burns, and smoke inhalation, I'm gonna say y'all are gonna go next week. Okay? Because I have to pick up a 14-year-old and do full hair and makeup for a play rehearsal tonight. So.
We can make a
I'll come do it.
class-wide vote to all just take pictures and start them at the house.
Well, we're gonna go till 2:30. 2:30, we're done, so I can go pick up the child and do hair and makeup. So who wants to go next? All right, Carson, what you got?
So a 17-year-old male presents to the ED coming from football practice and complains of feeling hot, dizzy, showing signs of ultra-mental status. Upon assessment, the patient has dry, hot, flushed skin, and his oral temp is 104.8. He's showing signs of stroke. If it were the early signs, it would be heat exhaustion. So those signs are heavy sweating, cool, clammy skin, dizziness, nausea, headache, muscle cramps, and weakness. When it turns to heat stroke, they stop sweating, they're hot and flushed, multi-mental status, possible seizures, a temp of greater than 104, and a decreased level of consciousness, sorry. For treatment, biggest things would be IV fluids. They're dehydrated. You can put a cooling blanket on. With hyperthermia, it doesn't matter how fast, right? It's not dangerous to cool them to get quickly. You can go ahead and do it. PRN, O2 support, electrolyte correction, especially their sodium and potassium. You're going to monitor their core temp, bladder, rectal, or esophageal. Use antipyretics, antipyretics don't work. Don't use them. Monitor for organ failure, dehydration, monitor eyes, nose, and then monitor for increased intracranial pressure that can turn into cerebral perfusion pressure, then go to ischemia, and then herniation. That's next week. And then fall seizure precautions.
All your hypothermia people they're in shock, hypovolemic shock. So what we talked about earlier with the circulation issues, with the volume depletion, hyperthermia people fall into that category because they sweat out all their fluids. Love what she said, cool down as fast as you want to. There's no harm in cooling them down quickly, whatever that may look like. We can do cool IV fluids. We can put down an NG tube with cool flushes, cooling blankets externally. So we can do a lot of different things that we can try and cool them down quickly. Big things is prevention, is doing a lot of our education. This is why football practice out in August has gotten a lot different than what it used to be because they have to bring the kids in, get them out of the super hot heat, and make sure that they're drinking plenty of water, plenty of Gatorade with all the electrolytes in it. So hyperthermia, they're really massively dehydrated people. All right, hypothermia, You wanna go with that one since it's the opposite side of the hyperthermia?
Okay, we forgot about the case study, so we made up a little story. Me, Allie, and Ava were outside building a snowman on the one day that you get snow in Alabama. And Ava is hard like that, and she went out there in shorts and a t-shirt and her rainbow flip-flops. So. Okay, this is your conversion formula for Celsius to Fahrenheit. We're gonna talk in Fahrenheit because I don't know Celsius. Your core body temp is below 95, and then it's severe, your core body temp is below 82. There were a bunch of different, ranges for that, but.
I ain't never seen below 86, that's my lowest.
Okay.
82?
That's what the.
That's what that book said.
Nurse
Good night,
Manager's book.
86 my lowest I've ever seen. Okay.
So for early signs and symptoms, we broke it down into your body systems. So for neuro, you're gonna have shivering, confusion, slurred speech, and decreased coordination. Then for your cardiac, you're gonna have initially elevated heart rate and blood pressure. That's your sympathetic response to your cold stress. You'll have atrial arrhythmias, and you have to move your patient slowly because it'll send them into something worse. Your respiration, they're gonna be tachypnic at first. That's your body trying to increase the metabolism. Your skin is gonna be cold, pale, and you're gonna have chill bumps, goosebumps. As your temperature continues to decrease, you're gonna go into your late signs and symptoms. So your shivering stops, and that's like really super bad. You have decreased level of consciousness that can lead to coma. Your pupils will be fixed and dilated, which mimics dead. Your cardiac issues are gonna be all very slow, very low, decreased heart rate, decreased BP. You can go into BFib or asystole. You're gonna have non-palpable pulses, no audible heart sounds, shallow respirations. Your skin is gonna be cyanotic and mottled. The big thing for that is the paradoxical undressing. She said it's like Ricky Bobby when he's trying to come out of his suit after he's been set on fire, right? Didn't that happen? His truck's on fire?
Weird.
But yeah, they're like, it's the final sensation of heat because your blood vessels finally relax, and at that point it's just kind of like, oh crap. No atropine. It does not fix the bradycardia. You have to fix the temperature problem first. So for your treatments, you have to warm these people very slowly. If you warm them quickly, it leads to shock, and that's kind of irreversible. So at that point, you remove their wet clothes. So Ava, she just decided to make snowman, and she was all wet. Get her out of her wet clothes. You want them in a warm environment to like cut the heat up in the room, put warm blankets on them. The bear hugger, it's like a trash bag that you put heat into, essentially. You do a continuous heart monitor, their vital signs with their labs and their temps, so the temp sense of Foley, hypoglycemia, electrolyte imbalances. Warm humidified oxygen, warm water immersion. If you do that for their extremities, it has to be just a few degrees above their current temp. CPR if it's below 95. Isotonic fluids. Hemodialysis in extreme cases is like the fastest way to get their body temperature back to not dead levels. And she's not dead until she's more than dead. So.
Very good. So that's a legal statute. You can't be pronounced dead if your body temperature is below 95. So you have to have a body temperature above 95 to actually be pronounced dead. And that's because of what she said, the lake signs, like everything just slows down. And you can go into VFib and asystole. So as we gradually warm you up, because we can't warm you up quickly, we have to warm you up nice and gradual. As we warm you up, you can actually go back into sinus rhythm, your blood pressure can come up and you can survive. This is how we've had instances of people surviving being underwater for 30 minutes. Because if they fall into a frozen lake, they go into hypothermia, all your metabolic demands go down, and you can survive that. So we will actually induce hypothermia on post-code people to try and salvage their brain function. So so that's, some hospitals will do that. Grandview doesn't do it anymore, but I think the UAB St. Vincent still do that. Research is controversial. But yeah, legal statute, not dead till you warm to death. No atropine, because like you said, you've got to gradually warm them up. If you increase their heart rate with atropine, then you've just made literally everything worse, because their body is not ready for a high heart rate. So that can be very, very detrimental. But we're showing grain, like if you see a heart rate of 20, give atropine. But these people, no, warm them up nice and gradual. And yeah, the paradoxical undressing, they're so cold they think they're hot. And they start taking their clothes off. All right, what's about next?
How about rabies?
I'm making them go, let's see, y'all go, and then maybe the drowning people, maybe the snake-type people.
Okay, so
You think you're gonna talk loud enough?
I will try.
Anyways, when you're facing this way, they can't even hear you facing this way.
Okay, I'll
Turn around.
I can't read it from turn around.
That's why you come up here. Stand up.
Okay, so we did rabies. Dr. Stacy Hicks is a 44-year-old female who presented to the ED due to an animal bite from an undomesticated raccoon. So she reports that she was hiking in the forest and she was taking pictures of poisonous leaves for her nursing class, and then this crazy raccoon came out and tore some of her arm off. So, but she did fight back, and she did also put a tourniquet on herself, which is good. She was also bit 4 hours ago. So upon assessment, she reports 7 out of 10 pain in her left forearm. The wound is a 10 centimeter, so about like that much, by 5 centimeter wound. That's about, I think it said, 3 centimeters deep, and it has non-approximated edges. It's laceration. Scan amount of blood noted due to the self-made tourniquet as 5 centimeters tied above the wound. Her vital signs are stable, and the skin surrounding the wound is warm, red, and swelling. So we're already expecting rabies. So we're going to flush her wound with normal saline irrigation for 15 minutes, and we're going to follow it with an antiseptic cleaner on wound surfaces. This can be like iodine or betadine or anything like that. We're also going to refer to the healthcare provider for assessment of wound. We might do stitches if we take off that tourniquet and she just starts bursting out blood. She might have hit an artery. I don't know. So we're going to also put her in an isolation room and get contact precautions, especially contact with her saliva, because it does transmit by saliva. Get rabies vaccines and immunoglobulin, and do routine labs and test for rabies. Obviously, I don't know where that raccoon is, so we can't test the raccoon for rabies, unfortunately. We're also going to get her a tetanus booster to see if, because tetanus is transmitted by soil, and that raccoon could have been, his claws could have been touching soil, so you don't know. And just education and of preventing animal bites, so staying away from animals, and making sure people know where you're going when you go out to the woods by yourself. Please don't go looking around in bushes, girl, what are you doing? And you want to report any rabies case to the public health authorities and the CDC, because it is kind of a big deal. It is, so you can do that. That's it.
All right, so to add for this, like she said, you have to notify authorities. So if this was like a dog bite or something, like a feral cat, like out in the neighborhood, you want to make sure that you've notified the appropriate people so that other people don't get bit. So we do have to notify authorities. The rabies vaccination, so we'll do the first one in the ER, but the rabies vaccination is a series. So education for the patient is going to be make sure they know where to follow up to get the next rabies injections. I think it's like 3 or 4 set series. I'm not 100% sure if it's 3 or 4. Okay. So that's not as easy as it seems like to get sometimes. So my friend they were camping and her husband got bit by an unknown animal and got bit in the dark trying to go out to the bathroom. And so they were in Tennessee hiking. Tennessee ER, they got the first rabies injection. And when they came back home to Alabama, it took over a week for them to find where they could get the next dose, so they didn't have to drive all the way back up to Tennessee. Because nobody in Alabama wanted to give it to him unless he could prove he got the first, whatever. He finally found somewhere, but it took like a week. So it was a mess. But it's the education that they have to come back and follow up on those rabies injections. They have to do the full series. You can't just stop after the one. Flushing the wound out, because it's transmitted in the saliva, so we want to flush all the saliva out of the wound as much as possible. Only stitching it closed if it's bleeding. Otherwise, 'cause that's what she said, only gonna stitch it closed if you take the tourniquet off and it starts bleeding pretty good, because we don't want to trap any bacteria inside that wound. It's a dirty wound. So it's from an animal, out from, maybe have soil, dirt, whatever. So we don't want to close that up and create a big old abscessed arm. So only stitch it closed if it's got arterial bleeding or really bad bleeding. Very good. All right, who else wants to go? My drowning people or my snake bite people? Drowning people? Drowning people. I'm gonna tell you the same thing I told her. Y'all look quiet voice people. You gotta have a mama voice to be talking this way and y'all still hear. Alright. I'm just gonna read it.
Alright, HB is a 6-year-old boy who was pulled from a backyard swimming pool by a neighbor. The recorded submission time is approximately 3 to 5 minutes. He was limp upon rescue. The neighbors initiated rescue breathing and CPR until EMS arrived. And the emergency department, HB is spontaneously breathing, but with labored, shallow respirations. His skin is cool, pale, and initial vitals, temp is 95, heart rate is 135, blood pressure 88/45, respirations 40, oxygen 86, on a non-breather mask. GCS is 9, pupils are equal and react sluggishly to light, crackles and wheezing upon osculation of lungs. So assessments, you'll want to do neuro check, skin assessment, access airways, vital signs. Expected findings is respiratory acidosis, chest x-ray, pulmonary edema, hypothermia, and interventions. The non-breather, rebreather mask, monitor respiratory status, initiate IV access, administer IV fluids, hypothermia management, obtain labs for APG and electrolytes, NG2 for decompression, and intubation.
Thank you. So when you're reading on your ear drowning, I'm not gonna ask you the difference between like ear drowning in a pool, in the ocean, in the lake. Like I'm not gonna differentiate between the different types of water that can get inhaled, so don't get bogged down in that. We're just gonna go, they inhale some water of some type. So one thing I wanna add to theirs that I forgot to tell them to add is these people are gonna be on antibiotics because lake water, dirty. Ocean water, dirty. And just any kind of water that you inhale, they're gonna be at risk for developing pneumonia later on, so we're gonna start them on antibiotics. Yes, prophylactic antibiotics, we're gonna go ahead and address it. So mainly we're gonna worry about their airway. They may have to have a lot of suction to clear their airways out. She went 100% O2. This is not somebody who start with just 2 liters, like we're going 100% O2 to go ahead and deal with this because they're gonna have some degree of hypoxia going on. They also have hypothermia if they are, submerged in water. So you gotta add your hypothermia treatment in with them as well. So everything with hypothermia goes with our near drownings. Why do we do an NG2 for near drowning victims, they're still at risk for lung issues for up to 48 hours later. Because if you inhale chlorine, salty ocean water, infected lake gross groundwater, what are your lungs gonna do in response to chemicals and bacteria and all that kind of stuff? What are your lungs gonna do? And they're gonna get really inflamed and pissed off mad because they're not supposed to have any of that stuff in there. Especially chlorine, like, cause it's all that chemical stuff. So they can go into pulmonary edema up to like 48 hours later. So you can have somebody that comes into your ER initially after a near drowning event, or you can have somebody come into your ER. We had an event 2 days ago and now I can't breathe because all the swelling has happened and they've gone into pulmonary edema after, like even up to 2 days after that event. So people may think I'm fine, like my kid was okay, like we pulled them up out of the water. You know, this is not a big deal, they're fine, and then 2 days later they can't breathe. And so then they're coming into the ER, so that's why our health history is really good. Then we just treat them like pulmonary edema, start them on antibiotics, diuretics. You treat pulmonary edema just like you would any other time. Alright, any questions on those? Because we're cutting it off there. Any questions on any of our exemplars? Alright, so one question, what we got?
I'm just asking about the drowning. So like 48 hours later, that happens station because of all that blood. Would it be like dry drowning?
So dry drowning is not really like kind of a term anymore. It's really just, it's